Hi, this is a case presentation for scleroderma. A patient, 39 years old female, her chief complaint, pain in teeth number 4 and 5, currently taking Norco and Tramadol. Her vitals, blood pressure 125/84, pulse 71, respiration 18. Past medical history, scleroderma, Raynaud's, was hospitalized in August 2012 for acute episode, gastric ulcer, and fibromyalgia. Medications: Norco, Tramadol, Lyrica, Ranitidine. Our exam reveals skin face within normal limits, lymph nodes within normal limits, TMJ noises on no pain, intraoral poor oral hygiene. Patient mentioned that she brushes once a day and never floss. Tooth number 4 had previous root canal and no crown. Tooth is badly decayed. Mucosa, tongue and gingiva within normal limit. X-ray findings: periapical radiolucent area for number 4 and 5. Number 4 had previous RCT and number 5 extensive. Assessment: patient is oriented to time and location, and she is motivated to get rid of pain by accepting root canal treatment for number 4 and 5. I explained to the patient, due to her current medical history and medication, we need to get medical clearance from her physician. Our plan of treatment: root canal treatment for teeth number 4 and 5, build up and crowns. What is scleroderma? Scleroderma, also known as systemic sclerosis, is a chronic systemic autoimmune disease characterized by hardening of the skin, which is a derma. In the more severe form, it also affects internal organs. Types: we have limited type and diffuse type. Limited type involves cutaneous manifestations that mainly affect the hands, arms, and face. Calcinoids: this is deposition of calcium nodules in the skin. Raynaud's phenomenon: exaggerated vasoconstriction in the hands, with fingers undergoing white, blue, red color transitions in the cold. Esophageal dysfunction leading to difficulty swallowing. Sclerodactyly: skin thickening on the fingers, and telangiectasis: dilated capillaries on the face, hands, and mucous membrane. What is the diffuse type? The diffuse type is rapidly progressing and affects a large area of the skin and one or more internal organs, frequently the kidneys, esophagus, heart, and or lungs. This form of scleroderma can be quite disabling. There are no treatments for scleroderma itself, but individual organ system complications are treated. What are the causes? Scleroderma caused by genetic and environmental factors. Mutations in the HLA gene seems to play a crucial role in the pathogenesis of some cases, but not all. Likewise, silica, aromatic and chlorinated solvents, ketones, trichloroethylene, welding fumes, and white spirit exposure seems to contribute to the condition in a small proportion of affected persons. What is the diagnosis? Typical scleroderma is classically defined as symmetrical skin thickening without, with about 70% of cases also presenting with Raynaud's phenomenon, nail fold capillary change, and anti-nuclear antibodies. Affected individuals may or may not experience systemic organ involvement. There is no single test for scleroderma that works all of the time, and hence the diagnosis is often a matter of exclusion. A typical scleroderma may show any variation of these changes without skin changes or with finger swelling only. Laboratory testing can show anti-topoisomerase antibodies like anti-CCL SCL70 causing a diffuse systemic form, or anti-centromere antibodies causing a limited systemic form and the CREST syndrome. Other autoantibodies can be seen, such as anti-U3 or anti-RNA polymerase. What is the treatment? Raynaud's phenomenon with vasodilators such as calcium channel blockers, alpha blockers, serotonin receptor antagonists, angiotensin 2 receptor inhibitors, statins, local nitrates, or iloprost. Digital ulcers with phosphodiesterase 5 inhibitors such as sildenafil. Prevention of new digital ulcers with bosentan. Malnutrition secondary to intestinal flora overgrowth with tetracycline antibiotics like tetracycline. Alveolitis with cyclophosphamide azathioprine with or without corticosteroids. Pulmonary arterial hypertension with endothelin receptor antagonists, phosphodiesterase 5 inhibitor, and prostanoids. Back to our patient medication. Norco. Pharmacologic category: analgesic combination. Narcotic. It is acetaminophen and hydrocodone. Use for treatment of post-operative pain, relief of moderate to moderately severe pain. Its effect on local anesthetic, vasoconstrictor precautions, none. Effects on dental treatment: hypotension, bradycardia, dizziness, sedation, nausea. Tramadol. Pharmacological category: analgesic, non-narcotic. Use to relieve moderate to severe pain. Local anesthetic, vasoconstrictor effect, precautions, none. Effect on dental treatment: xerostomia, dizziness, headache, nausea. Lyrica. It is anti-epileptic drug, anticonvulsant, used to control seizure, treat fibromyalgia, herpes zoster, or neuropathic pain. Ranitidine. The category: GI disorders, histamine H2 antagonist. Use Zantac short-term and maintenance therapy for duodenal ulcer, gastric ulcer, active benign ulcer. Effect on local anesthetic, precaution, none. We have to get a clearance from the doctor, so we have to send him a letter. So we are sending to Dr. Smith. Dear Dr. Smith, regarding patient so and so, I've seen the above named patient in my office, and patient is complaining of pain in the upper right maxilla. Exam and x-ray reveal that patient has an periapical abscess on teeth number 4 and 5. Our planned treatment is root canal treatment for those teeth, build-up and crowns under local anesthesia. Past medical history: scleroderma, fibromyalgia, gastric ulcers, and she was hospitalized last August for acute episode. Current meds: Norco, Tramadol, Lyrica, and Ranitidine. Please verify patient medical history, current and past medications, any other conditions we may not be aware with, any precautions for the proposed treatment, and the local anesthesia. Xylocaine with epinephrine 1 to 100,000. Any pre-medication, and in case of general anesthesia, what is the precautions? Thank you for your cooperation and prompt response. Sincerely, Akram Samuel, DDS. This is the end. Thank you.